Hi everyone, my name is Amit Chaudhary and I'm an occupational therapist. I would like to share a case study. Recently, I did some consultation. So, the kid's mom called me with some issues, and the kid is only 4.5 years. So, the issues is one, he has significant feeding problems. He really can't take all types of food. Even those food he used to eat, he is now refusing. He doesn't like anyone, even a teacher when come to teach him. He just refused. He does a lot of screaming. He's just jumping whole day and a lot of other issues. So what I found after that conversation, that the child may have really tactile defensiveness problem, and obviously he has significant feeding issues and he may be a problem feeders. And when I ask like what therapy so far has been done, mother told me that it's a lot of like deep compression and a lot of occupational therapy stuff. So I was not sure what exactly happened in occupational therapy session, but what I understood, like there were lot of forceful activity happened. The child was not ready to do something, but he was forced to do. And that is something what I feel, it's not I feel, it's like an ethical practice. You should not force a kid to do something. And I heard also that child was tied up and forced to do something. So that was really for me unacceptable something. Anyway, the main important thing is yes, our child can have this type of issues, like they are really defensive to tactile, and they have multiple problems with it. The tactile defensiveness may be the foundational issues, we have to really overcome it, but we need to know every child is different, and the approaches what we use, it can be different and it can be changes based on the individual needs. What we see in YouTube, like everybody is getting a gym ball and jumping on trampoline and it will help, no, it will not. We need to understand not only the sensory things, we have to understand the cognitive abilities. We have to understand the kids as an individual, the kids mental conditions, his understanding, his what he likes, what he dislikes, and moreover how he connect with the pupils, how he connect with everyone. You need to make a bonding with the kids first. You have to make a connection with the kids first. And when a child like with this profile, first you have to do to make a connection before you do anything. So you have to make a connection. It means when you are able to make a connection with the kids will follow whatever you are going to tell him. And that come with lot of practice, lot of patience. Like one example, you may have to do lot of modeling first, even before you give a instruction. You have to also understand the kids have really the ability to follow instruction or not. So once you get all these functional component, what the problem in the kids to do a functions, and what really the kids struggle, then you can make it, you can plan it, you can change your communication, and you can change your approaches, and that will make a strong connection with the kids. And you should not force these kids for anything. You have to make a strong bonding, you have to do modeling, you have to facilitate the kids to do something actively, so the kids can get all the sensation like deep pressure what he needs, but he has to get it actively, not passively. Yes, in some condition you can give passively. It's depend on the kids. If the kids it's ready to take, if the kids has the acceptance to take a passive joint compression. Otherwise you have to provide an environment where the kids whatever he is doing throughout it, the kids is getting the sensation. Like one example, if your kids is not ready to follow your instruction, you maybe just put a bin bag or or something like what is not really same like your floor, and you may just play there with your kids. And when your kids will actually uh, stand on the bin bag, he will get the sensation. It's a different surfaces, it's a different texture, he will get it. Then you can encourage him to do something what is more interesting for him when he's sitting on the bin bag. So again it's a different exposure of sensation. So what I'm trying to say, you have to create the opportunity, and through that opportunity your kid will get the exposure of different sensation. And that if it is specific to proprioceptive, you have to understand how the kids can get lot of deep pressure by himself when he is doing some activity, right? You can just arrange a game where he will do lot of rolling. Kids basically those have tactile defensiveness issues, and if you really ask the history of development, you will find they did very less rolling activity in their earliest stage of development. So you have to plan something, you have to design some activities, and those activities you have to perform first in front of the kids. Then kids will learn. You have to model a lot. So what I really want to share in this video, that if your kids is crying when he's learning something, you have to change it. You have to get alternative things. You have to see how your kids is not getting getting any trauma, because once your kid will feel this is not interesting for him and this is something uh, really forcefully happening with him, that will not be a good result end of the day. Maybe he will learn the particular things for uh, for a little range, but it will not help him for his future. So you have to, it's good, you should consult with an occupational therapist who is experienced in pediatric. And you can like Google is available. You can see in Google there is like all the approaches is talking about how you can provide a child directed therapy rather than anything forcefully. Okay, so hope you understand it. What I tried to say, I tried my best to convey this message. But if you have any question, you can please put down the question in the comment box. Thank you.